Today we will be talking about the VA Shift Tool, Safe Handoff Initiative for Transitions of Care.
Patient handoffs are dangerous for patients, time-consuming for physicians, and a common source of costly adverse events in the hospital.
According to the Joint Commission, 80% of serious medical errors are related to handoffs. The root cause of most hospital sentinel events is poor communication. The Institute of Medicine estimates that there were 98,000 preventable deaths related to handoffs.
This is the new patient safety dashboard.
The dashboard will function as a central source of important patient information, a team-based to-do list, a handoff tool, and eventually a rounding list. Patients will be organized automatically by team. Interns will see only their patients, while attendings and seniors will be able to view the whole team at once. From the dashboard, you'll be able to view a lot of information quickly. First off, you can see that patients are organized by acuity. Red means watch closely, and green means the patient is stable. You can change the acuity by clicking on the colored circles to the left of the patient's name. Using the dashboard, you will be able to see when the patient was admitted, their most recent vital signs with abnormal readings highlighted in red. You will also be able to view the patient's diet, location, diagnosis, and code status. The dashboard will also serve as a team to-do list, and you may add tasks by clicking on the plus sign to the right of the patient's name. There are some preset categories such as consults, studies, etc. You may also add them by free text. You can then assign them to any member of your team, either by name or by role. The tool will automatically populate some tasks. For example, a task will be created if a new lab, study, or procedure has been resulted. The labs will include basic labs plus micro and pathology results. These results will be viewable in the dashboard using a hyperlink. If you click on the patient's name, it will bring you to the handoff tool screen. Here you will communicate important information to your handoff partner. From this view, you can see critical handoff information such as patient name, admit date, code status, and location. You can also view vitals, including a range, a brief assessment brought in automatically from the admit tool, interval events, and access. You can also view a medication list that is organized by indication, labs, studies, orders in the past 24 hours, and tasks from the cover sheet. There is also guidance for certain common sign-out situations. Basic labs are displayed automatically. If the value is outside the normal range, it will be highlighted in red. If you want to add specific labs, you may click on Other Labs. This will give you the option to include non-routine labs in the handoff if desired. You may click on any of the individual labs to show a trend. The Studies section shows all the studies done since admission. You may use the magnifier glass to see the results without leaving the screen. This is the guidance screen. You can give your colleagues advice on what to do for common problems that arise overnight. When you're done entering all your work, you can print out all of your sign-out by clicking here. You can assign your patients to the covering physician electronically by selecting their name from the drop-down menu. If you use the tool wisely, you may just become a sign-out champion.